Hi, I'm Dr. Matt Ashley. I'm the Chief Medical Officer for Center for Neuroskills. I first started my career with CNS way back in the 1990s when I worked. My first job was actually working with storage files and managing medical records, which at that time were paper records housed out in a storage unit off of Truxton Avenue. And my job was to organize them and shift them around in these tin sheds in the Bakersfield heat. From there, I eventually worked with patients as soon as I was able in a capacity of what would now be considered an NRS role or a clinic aide. At the time, we called them rehabilitation assistants. And I did that for a few years. And then I went off and did a whole bunch of education and came back about 6.5 years ago as a consulting neurologist, treating patients in Bakersfield and Los Angeles. And from there, I've taken on a more administrative role as the medical officer overseeing the medical care as a whole for the company. My favorite story of managing a patient at CNS goes back to those early days of the 90s. I remember driving over to the Central Coast of California to pick up a patient with one other staff member. And when we drove him back across the state to the facility in Bakersfield, the entire time he was having behavior, kicking, biting, spitting, and he was quite a bit to handle. And it was very gratifying when a few months later, we took him home to be with his wife and family, and he didn't have any of that behavior. We did what we do, and we gave him and his family his life back. And I think for CNS, that's really what we're about. And I think that speaks volumes to the people who do the work. And that's why we have so many people who stick it out for so long, and why we have CNS as not just a family company, but a family of employees. And I'm proud to be a part of it. Here's to 40 years, and I hope you have 40 more.